We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe, but we're celebrating our 10th anniversary of Health Matters radio program. We are planning some special shows to celebrate the milestone, and we do hope that you will stay tuned. So let's begin today by thanking our sponsors, Studio Arts and Glass, Cleveland Clinic, Mercy Hospital, and, of course, our socially distant technical producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our special guest, Megan Woods, RN, Nurse Navigator for Cleveland Clinic Mercy Hospital's Cancer Center, and Amy Thiel, RN, Nurse Navigator for Cleveland Clinic Mercy Hospital's Cancer Institute. Good morning, and welcome back to the show.
Good morning. Morning.
All right, before we get talking today about our topic, I wanted to let the community know that we at the Medicine Center Pharmacy and the local health departments still have COVID-19 vaccines available. We wanted to touch briefly on the subject because recently it's come to our attention that a large number of patients that are over age 50 have been vaccinated, and that's wonderful. But our population between 18 and 40 is really less than 0.25%, or less than 25% vaccinated. So, I guess I challenge you, even if you think you're really healthy and you don't have to worry about getting COVID-19, or you think that you're tough. We all think we're invincible at a young age, myself included. But, keep in mind that one of the best ways to prevent getting COVID-19 is to get vaccinated. Once you're fully vaccinated, you can start doing more. I can't wait till in the coming weeks, we hopefully will hear Governor DeWine say we can ditch the masks in the workplace because the vaccination levels are so high and the cases are so low. But we can't get there unless the majority of the percentage gets vaccinated. So if you have questions about the vaccination, by all means, give our pharmacist a call at the Medicine Center. We'd be happy to talk to you and give you the facts. You're not going to get COVID from the vaccine. It's not going to mess up your DNA. You don't have to worry if you're going to have a baby someday that it's going to cause any damage. There have been hundreds of millions of people vaccinated in the world. And while recently you may make note of a couple issues that happened with a particular vaccine, those are 1 in a million cases, and there are flags that we can talk to you about before you get the vaccine to make sure you're at minimal risk. So don't be afraid to ask questions. Don't be afraid to trust your neighbor that's not a medical professional. We got a lot of good data, and we just want to make sure that everyone can be safe and effective and have their vaccine. So reach out to us at the Medicine Center. If not, I know they have vaccines also at Cleveland Clinic Mercy Hospital. So please ask questions and be informed, okay? So with that, we're going to talk about skin cancer today. And I wanted to remind everybody that over 5 million cases are diagnosed in the United States each year. Skin cancer is among the most commonly diagnosed cancer. Fortunately, skin cancer is also one of the most preventable forms of cancer. About 90% of non-melanoma skin cancers and 85% of melanoma skin cancers are associated with exposure to UV radiation by the sun. By sharing facts about the dangers of unprotected exposure and encouraging people to check their skin for warning signs, we can make a significant difference. This morning, we're going to talk with Megan and Amy about skin cancer prevention, diagnosis, and treatment. We'd like to remind you all listening that our program is available on our podcast. You can pick up your favorite podcast app and look for Health Matters with the Medicine Center Pharmacy and subscribe to our program and listen anytime.
So, Megan, welcome to the show. We'd like to thank you for your service as a nurse, especially during this pandemic. Please tell our listeners about yourself and your responsibilities at Cleveland Clinic Mercy Hospital.
Well, thank you, Paul. I just wanted to care workers across the nation right now are kind of starting to run on an empty tank. So any simple gesture of gratitude really goes a long way. So thank you. We appreciate that. My name's Megan Woods. I'm a nurse navigator here at Cleveland Clinic Mercy Medical, and I have been a nurse now for 20 years, which is hard for me to even say, but it's been 20 years. And I am actually kind of new to the navigator position, so I'm figuring that out as I go, but it's a great opportunity. So far, I absolutely love it, and I love being able to help the cancer patients that we have come through Cleveland Clinic Mercy.
So, Amy, welcome to the show. Like Megan, we'd like to thank you for your service as a nurse, especially during this pandemic. So tell our listeners about yourself and your responsibilities at Cleveland Clinic Mercy Hospital.
Thank you. Again, like Megan said, we really appreciate the thanks. It has been a trying time for nurses in this pandemic, but we're strong. We're going through it. I've been a nurse for over 10 years now. I've been in oncology that entire time, so oncology nursing for 10 years. I love my job working with cancer patients. It's rewarding. It just being able to help a cancer patient get through their journey is a wonderful thing for us.
What does the title Cancer Nurse Navigator, take a minute and explain what that means and how it benefits the lives of patients you care for and how it sets Cleveland Clinic Mercy Center apart?
So nurse navigators are kind of involved in a lot of things, and we go through cancer patients' journey with them from start to finish. So we're also there as a means of support, which could be for financial reasons, any questions that should come up, understanding the diagnosis and treatments that are available, any information that might be needed, accessing information about, Social Security, disability, if people are facing not being able to go back to work, how can we help them there? Any issues with transportation that may come up, because obviously there's going to be a lot of appointments with a lot of different specialties. If you need help with transportation, we can help with that as well. Identifying any additional needs that may come up during the process. We've had patients that, haven't had a bed to sleep in. They were sleeping on the couch of someone's house. And that need arises, and there are things that we can do to help that person out. I mean, heaven forbid, someone diagnosed with cancer is sleeping on a couch instead of their own bed. And anything else that could come up that you could think of. I mean, we have connections with pastoral care, home health nursing. I mean, really anything that should come up during your diagnosis and treatment, we're there to support that.
So do both of you specialize in a particular type of cancer, or do you work with all patients with cancer?
Well, we do work with all patients with any type of cancer that comes in and has a need. We fill that need as it comes, but I do work specifically with breast cancer patients. I know Megan works with lung cancer patients, but yes, we work with all different cancers.
So the statistics on skin cancer are pretty startling. Is anybody immune to this any type of skin cancer?
That's a really, really good question, Paul. And my favorite answer to this question, even when it pertains to all cancers, is unfortunately cancer does not discriminate at all. No one is really immune from cancer. Now, obviously, there are certain risk factors that make your chances greater, such as smoking, obesity, lifestyle. For skin cancer, it's more common among people with a light or a fair skin tone. However, again, skin cancer can and does affect everyone.
Can you tell our listeners what the most common types of skin cancer are?
So there's lots of different types of skin cancers, but there's really three major ones that you hear about the most. And that's basal cell carcinoma, squamous cell carcinoma, and then the dreaded melanoma. So just real briefly, basal cell carcinoma usually occurs in sun-exposed areas of your body, such as your neck or face. Squamous cell carcinoma occurs on sun-exposed areas of the body, such as the face, ears, and hands, and melanoma can develop anywhere on the body or in an existing mole that becomes cancerous. So those are the three large ones. And as we'll discuss later, really the key to all of this is early detection. So in a little bit, we'll talk about what each of these look like and what are things on your body that you need to be watching and look for, and then you can contact your doctor if anything is unusual about that.
How about we touch on risk factors? So what might people be aware of to make sure that they're not putting themselves at increased risk for skin cancer?
So once again, anyone, like I said before, can get skin cancer, but people with certain characteristics are at a greater risk. We're looking at a lighter, more natural skin color, skin that burns easily, freckles, reddens easily, becomes painful in the sun, blue or green eyes. So people that have blue or green eyes tend to have lighter, fairer skin tones, so that's a risk factor. Blonde, red hair, again, usually a lighter, fairer skin, so those are risk factors. Certain types and a large number of moles on your body. Family history of skin cancer obviously brings your risks up. Also, personal history of skin cancer, and then also older age.
Okay. So what about, do you recommend a patient do a self-check, if you will, to kind of see what they're looking for, and how would you recommend they go about that?
Absolutely, and the theme of what I'll keep repeating through talking is early detection is key. So that being said, self-checks are extremely important. They should be done probably at least once a month. Now that we're going into warmer weather, we're going into bathing suit season, so a lot of people are trying their bathing suits on right now, so it's recommended to stand in front of a mirror and look over your body. Very simple. Now, that being said, do I see my husband taking the time to do this? No, I don't. So now that I am aware of what to be looking for, I can check my loved one as well. And if something looks suspicious, then I can bring it to his attention and get him to go to the doctor. But it is extremely important to self-checks. You want to look for anything that changes or looks different than you're used to seeing it. So that's why it's important to do these things now, so you have a baseline of what your body normally looks like. And you can monitor areas that look a little iffy.
I think the self-check's important because I personally was able to flag a situation on myself that I thought looked a little weird. And, you can identify something and then watch it for a period of time. But, if something looks strange for too long, it's definitely worth checking with your physician. So,
one more question, or we take a break?
I think we could go ahead and take the break. We're ready.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Hundreds of new items have arrived at the Half Off and Out By store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. Memory foam pillows, canning supplies, lawn mowers, massage chairs, and lots of new toys. Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing skin cancer with Megan Woods and Amy Thiel, cancer nurse navigators from Cleveland Clinic Mercy Hospital.
Okay, before the break, we talked about doing skin self-checks. So what signs and symptoms should patients report to their physician?
Changes in your skin is the most common sign of skin cancer. So it could be a new growth. It could be a sore that doesn't heal, changes in a mole. For melanoma specifically, a simple way to remember the warning signs is to remember the ABCDEs of melanoma. So A stands for asymmetrical. Does the mole or a spot have an irregular shape with two parts that look very different? B stands for border. Is the border irregular or jagged? C is for color. Is the color uneven? D is for diameter. Is the mole or spot larger than the size of a pea? E is for evolving. Has the mole or spot changed during the past few weeks or months? So talk to your doctor. Obviously, if you notice any changes in your skin, such as a new growth, a sore, like I said, that doesn't heal, a change in an old growth, or any of those ABCDEs of melanoma.
Very useful information. Wow. Okay. What can we do to prevent skin cancer?
So there's a few things that we can do to prevent it. And the biggest one is your sun exposure. So what can we do to limit sun exposure? So first, the recommendation is to avoid sun during the middle of the day. Now, for North Americans, the middle of the day, when the sun is the strongest, is going to be 10 a.m. to 4 p.m. Well, you think, well, there's my day. But unfortunately, that's when the sun is the strongest. So they recommend that if you're doing a long outdoor activity that maybe you adjust the time a little bit, do it in the morning or later in the evening. Even if it's cloudy outside, it doesn't make a difference. So make sure that you're aware of that. The second one is to wear sunscreen. And we'll talk a little bit later about what the proper way to put sunscreen on is, which is also important. It plays a major role in sun protection. The third is wear protective clothing. So cover the skin with dark, tightly woven clothing. You'll see the new thing now is rash guard type of clothing. A lot of dermatologists will actually recommend specific rash guards that you can purchase to be able to cover your skin. It is a big thing right now. You can find them anywhere. They prefer that you wear black. You can also wear broad-brimmed hats, so that can cover your facial area and your ears and some of your neck. They recommend that over a simple baseball cap. Avoid tanning beds, and we'll talk about that a little bit later, too. Tanning beds are not good for you, and we'll discuss why. be aware of medications that can cause an increase in sensitivity to the sun. They are out there. They can be prescription medications, over-the-counter medications, even antibiotics. So you want to make sure that you ask your doctor or, like these lovely gentlemen here, your pharmacist, to find out which medications cause sun sensitivity. You need to be aware of that. And then lastly, like we said before, you want to check your skin regularly and report any changes to your physician.
Okay, you just mentioned tanning, okay? And I know a bunch of people that have changed their skin color through tanning practically. So what's the future for those people?
Not good. So the issue with tanning beds is that they didn't become commercially a thing in America until probably about the late 1970s. So the research on tanning beds is a little bit behind what we have research-wise in regards to sun exposure. So now that this research is coming out, they're seeing how bad tanning beds are for you. They are harmful. There's 3 types of UV radiation. There's UVA, UVB, UVC. UVA and UVB actually does come from tanning beds, and they say that the tanning beds actually increase intensity by 3 times of what the amount would be if you were out in direct sunlight. So it's more intense. Since the late 1990s, there's mounting evidence has shown that the link between tanning beds to all types of skin cancers. And in 2002, they came out and found that the use of indoor tanning devices were associated with a 50% increase in basal cell carcinoma and more than 100% increase in the risk of squamous cell carcinoma. And lastly, in 2007, they concluded that using indoor tanning before the age of 35 had a 75% greater risk of developing melanoma. So these are all scary statistics, and that's why we want to try to stay out of tanning beds. There are a couple myths out there that they try to do to push people into indoor tanning, and the biggest one is they say that you have to have a base tan. So by using your indoor tanning, you can get a base tan so that way that the sun won't cause as much damage when you're out there. That's not true. A base tan is the equivalent of an SPF of 4. So it's not really adding a whole lot. The other big thing is they claim that it helps increase your vitamin D. And that's all fine and good. Vitamin D is very important. It's something that you can discuss with your physician, but you don't need to lay in an indoor tanning bed to be able to get that. There are many over-the-counter supplements nowadays that you can purchase with no risk at all and get it that way.
You're listening to Health Matters with the Medicine Center Pharmacy. We'll be back in a few minutes.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Do you have to test for blood glucose? We know test strips can be very expensive at many pharmacies. At the Medicine Center Pharmacies, we supply you with a free Easy Max kit, monitor, and strips to either continue or begin with a new blood glucose monitor. And when you buy a package of 50 strips, they're only $7.99. And only at the Medicine Center Pharmacies you'll find this bargain in Canton, Louisville, Minerva, and New Philadelphia. See us on Facebook for more healthcare bargains.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Okay, you're listening to Health Matters with the Medicine Center Pharmacy. As our producer said, I'm your host and pharmacist, Paul White. Just a quick reminder that Janssen's COVID vaccine is available for immunization at all of our Medicine Center pharmacies. We have a lot more to cover this morning, so let's get back to the show.
Okay, we were talking about tanning beds before the break, so let's talk about something else. Let's talk about ethnicity or skin tone and how that might affect the type of SPF you might need when selecting sunscreen. And why don't we talk about sunscreen, even though we don't live in Florida or California. That'd be nice, but we do have to worry about sun exposure in Ohio. So let's talk about that.
So it is true that people of color naturally produce more of a chemical called melanin. It gives the skin color, and it absorbs the sun's damaging UV rays. However, health experts advise everyone, regardless of skin color, to use sunscreen with at least an SPF of 30 or higher. Although dark-skinned people won't get sunburned as quickly, they will still burn and are still susceptible to sun-induced damage such as sunspots, wrinkles, and, of course, even cancer. So although fewer people with dark skin actually get skin cancer, the death rate, fortunately, for dark-skinned people with skin cancer is higher than for light-skinned people. And because they kind of have a false sense of security because of that melanin in their skin. They're less likely sometimes to take preventative measures, such as wearing sunscreen, also less likely to routinely check for signs of skin cancer. So as a result, when they do get skin cancer or when they're diagnosed with skin cancer, sometimes the disease may be in an advanced stage and more difficult to treat. So increasing awareness of the importance of sunscreen and routine skin checks, again, for people of all skin types, is an important part of skin cancer prevention.
So from lotions to sprays, what's the proper way to apply sunscreen for maximum protection?
So I think people in general are pretty good about knowing that they need to apply sunscreen. I think the problem comes with applying it correctly. So like what Amy said, it is recommended that everyone uses an SPF of at least 30 or higher, preferably water-resistant, and provides broad-spectrum coverage. That means it protects you against UVA and UVB rays, which both can cause damage. Once you have an SPF of 30 or higher, you want to make sure that you apply sunscreen before actually going outdoors. I think a lot of people are excited to get outside, they get out there, and they're standing in the sun while they're applying sunscreen. That could cause damage while you're standing out there applying it. So you want to make sure that you apply it indoors or out of the sun prior to going out into the sun. Make sure that you're applying enough sunscreen. It's recommended that you use at least an ounce, which is approximately a shot glass. So you're going to take a shot glass full of sunscreen to apply it. Make sure that you rub the sunscreen thoroughly into your skin. Remember to get the places that you might forget about, and that is specifically your neck, face, ears, tops of your feet and legs. And for those hard-to-reach places like your back, you can either ask someone to do it for you, or that's really where the sprays can come in handy. If it's in a hard-to-reach place that you can't reach, that's where you can use a spray. That would really be able to help you out. Lastly, you want to make sure that you reapply the sunscreen every 2 hours. And also immediately after swimming, or if you're getting super sweaty, you want to make sure that you reapply it. Now, it does say that it takes 15 minutes once you apply it for it to absorb correctly into your skin prior to going out into the sun. So make sure you cover everything, wait 15 minutes, and then go out, and make sure you're reapplying every 2 hours.
And you mentioned water resistant, but keep in mind if you take a dip in the pool, you need to think about reapplying when you get out and dry off, too. So, what about kids and adults? Do we have any differentiation and recommendations based on age?
The easy answer is no. Recommendations are pretty much the same. Reduce sun exposure, wear protective clothing, use a broad-spectrum sunscreen. Again, we're going to beat this into your head, SPF of 30 or higher. But skin does change with age, as we know, so make sure you know your body, make sure you know your own skin, and this will help you detect any abnormal changes because, again, skin changes with age. We're recommending very much that when, it's getting sunnier out in Ohio, woo, thank goodness, but so the kids are going out to recess now at school, so we're recommending wear a hat when you go out to recess. Lose the stocking cap, wear the baseball cap now for the kids. Also making sure that we're putting on sunscreen so kids as young as babies can still get skin cancer and can still have spots from skin. We can damage our skin from birth to death.
Does melanoma only affect the skin?
No. And melanoma is the deadliest form of skin cancer. And why it's such a problem is because it spreads, and it can spread to other parts of your body. Once it spreads, it's becoming a lot more difficult to treat. So that's why, again, back to my theme, early detection is kind of the key to everything. With melanoma specifically, the 5-year survival rate is 99%. But those are cases that are caught early. So you have to make sure that you're checking your bodies and being aware of anything that looks different or doesn't look right. Amy went over, the A, B, C, D, E of looking at areas that you're questioning. And people just really need to be on top of making sure that there's no changes going on in their skin.
Interesting. Okay, so even with the best prevention, there's a risk that someone could get skin cancer. What happens when they get diagnosed? What treatment options are there out there? And mostly topical, wouldn't I guess, or removal, or?
Yeah, it depends on the skin cancer that you have, or it depends on which of skin cancer you have. If your doctor determines that you have skin cancer, you're going to have additional tests to determine the extent or the stage of the skin cancer, and again, what type you have. So because, like you said, superficial skin cancers, such as basal cell carcinoma, rarely spread, a biopsy that removes the entire growth often is the only test needed to determine the cancer stage. But if you have like a large squamous cell carcinoma or a melanoma, your doctor may recommend further testing to determine the extent of that cancer. So those additional tests might include imaging tests to examine the nearby lymph nodes, because we want to know if it's spread to the lymph nodes, a procedure to maybe remove a nearby lymph node to test it again for signs of cancer. The skin cancer stage is definitely going to help determine which treatment options will be most effective. Treatment options for skin cancer obviously vary depending on stage, type, all of that kind of thing. Depends on size, depth, location of the lesions. Small skin cancers limited to the surface of the skin may not require treatment beyond an initial skin biopsy that removes the entire growth. But surgery to remove the cancer is most often first if the cancer is too large to be removed by biopsy. And then after that, we look at treatments, radiation, chemotherapy. Immunotherapy is one of the new ones that we're looking at as well.
So you just mentioned one of the newer treatments. Are there others?
Well, immunotherapy, like I said, is some of the newest treatments that are out there right now. Immunotherapy is the use of medicines to stimulate a person's own immune system to recognize and destroy cancer cells more effectively. Several types of immunotherapy can be used to treat melanoma. I know a couple of the ones that you're hearing probably on commercials right now, Keytruda, Opdivo. Those are drugs that target a protein called PD-1, a protein on immune system cells, also called T cells, that normally help keep these cells from attacking other cells in the body. By blocking PD-1, these drugs boost the immune response against melanoma cells. So this can shrink tumors and also help live longer. So they can be used to treat melanomas that can't be removed by surgery or maybe that have spread to other parts of the body. They can also be used after surgery as what we call an adjuvant treatment for melanomas that have reached the lymph nodes, and again, to try to lower the risk of the cancer coming back. So there are a lot of treatment options available.
So would you start the drugs, these newer drugs on skin cancers that just appear, or?
Usually it's going to be if they can't have surgery, that's when we would start these. If surgery, we do have surgery, but maybe it's spread to the lymph nodes. Those are some of the reasons why we would use the drugs, the new ones, the immunotherapies. And they're usually a little bit better tolerated than a chemotherapy. So
how effective are they?
With skin cancers, I don't have the exact numbers, but they're very effective. Skin cancer is a very treatable disease.
And all over their advertising, all over cable, all over news, all over this and all, like everybody in the country has the disorder. Okay, so I think it's the Weather Channel. It's kind of interesting. The Weather Channel has lots of drugs on the advertising, so how about that? Okay, final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand name test strips. So stop in any Medicine Center pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Hundreds of new items have arrived at the Half Off and Out By store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. Memory foam pillows, canning supplies, lawn mowers, massage chairs, and lots of new toys. Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. And see us on Facebook.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show. So, what types of help does Mercy offer for people with skin cancer?
Skin cancer doesn't make it any different. We offer the same services for every type of cancer that's going to walk through the door. It includes, getting together with oncologists. We have a radiation department in-house that offers radiation. We also have an infusion center that can give in-house chemo if needed. We have a boutique that is available for wigs or prosthesis. We have nutritional support. The Navigators obviously are here. They can offer a lot of help. And then we also do a lot of cancer screenings as well.
Well, let's talk about cancer screenings. Can you share that information with our listeners?
Yeah, so the biggest one I want to mention is that Cleveland Clinic Mercy Medical is actually offering a free skin screening next month. It's going to be May 17th from 6 p.m. to 8 p.m. So if anyone notices something questionable that they want to get checked out, this would be the perfect opportunity to do it. And it's going to be held at Mercy's Outpatient Care Clinic in North Canton. The number to be able to register for this program is 330-489-1333. It will also be up on the Cleveland Clinic Mercy website within the next couple of days. So if you want to click on there and make a reservation. But this is a fantastic opportunity to be able to screen people for cancer. It's free. And along with skin, we have a lung screening program. And there's also a breast screening program that we do here at Cleveland Clinic Mercy.
Excellent. So you gave the phone number for the screening. That was 330-489-1333. How about, ladies, you share your contact information at the hospital for our listeners that maybe, your role as a nurse navigator, especially for patients and family members that are dealing with a cancer situation with a loved one, is certainly one that can be a very difficult time to manage. And I'm guessing that you've had a lot of experience in helping people. So why don't you give them your contact info, and then we can tie up some loose ends here before we end the show.
Sure. My name is Amy Thiel. I am the breast cancer nurse navigator, but I will take any calls. My direct line into my office is 330-588-4674. We also have a main cancer center line, so for just general questions or if you're looking for one of the other navigators, our main line is 330-430-2788.
And Megan Woods again, the Lung Cancer Navigator. My direct line is 330-458-4214. But like Amy said, calling the general line is a great way to come in contact with somebody as well.
All right. How about each of you leave some parting messages for our listeners today? Amy, you're up.
The main thing that for any cancer, again, that you have to remember, early detection, and I know Megan has said this many times, early detection is key. So those screenings, those self-checks, making sure you're aware of your own body for anything, for breast, for skin, for lungs, anything, making sure that you're aware of your own body and getting those screenings done, getting your yearly mammograms done, it will do wonders for you in the future. Also, wear sunscreen. Just wear sunscreen. I know you're not going to go to the beach wearing long sleeves and long pants and a great big wide brim hat, most likely. Most likely you're going to be in a bathing suit. So please just wear sunscreen.
It's one thing we kind of missed. What about these snowbirds that go to Florida for winter only? Do they all come back with skin cancer, or do you notice an increase in the spring?
I mean, I can't say whether we have an increase in cases in the spring or not. But yes, that's always a thing. But you can get sunburn in the winter as well. The sun reflects off the white snow. The sun reflects off of the pavement, ice, anything. So, I mean, you can get skin cancer in the winter as well. Whenever it's snowy out, whenever the sun is finally shining in Ohio, even in the wintertime. So, it's important to always make sure that you're doing these preventive measures.
The intensity in the winter can't be the same as the intensity in the summer, is that?
Well, I don't think it's the same. I think it's probably less UVA rays, but it's still there, and it's still, like I said, reflecting off of the snow. People that go skiing a lot, you see that as well. You see, the red face. Sometimes you can get burnt from that kind of thing, too.
Okay. Megan, any parting comments?
No, I think Amy covered a lot of it. I'll reiterate my theme throughout, which is early detection, which is what Amy said as well. I mean, really, that's the key to everything. And following the preventative measures that we discussed is a big deal, too. So even if you're a snowbird or not, as long as you're following those preventive tips, you should be in a good place. So please, everyone, look yourself over. Try to find out if there's anything weird going on. And not just you, keep an eye out for your loved ones as well, because like I said, my poor husband, I don't see him doing what he needs to do. I will gladly help him out with that.
Well, you both have mentioned how important it is to be an active self-monitor, if you will. But, we see patients all the time in the pharmacy that don't have a primary care physician and haven't had an annual physical in years. So don't overlook the fact that if you're looking for a doctor or you haven't seen a doctor in a while, even if you're healthy, it's always good to have that baseline check-in. And if you have a question on which doctors are taking patients, generally our pharmacists know who's taking patients, and we can try to help you. Maybe you can help at the Nurse Navigator line, too. I don't know. But, it's important to be checked out on an annual basis. So don't overlook that fact.
Okay, I think we're out of time. Thank you very much, guests. Megan Woods, RN, Nurse Navigator for Cleveland Clinic Mercy Hospital's Cancer Center, and Amy Thiel, RN, Nurse Navigator for Cleveland Clinic Mercy Hospital Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Cleveland Clinic Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank your listeners for joining us on Health Matters with the Medicine Center Pharmacy. And we'll see you right here next week on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.